Why abortions occur for some ladies repeatedly? So I want to tell you about repeated abortions, why they occur, how they get treated. There are so many reasons for the repeated abortions. First of all, I want to tell you about the uterine anomalies. Uterine anomalies, whenever the fetus, the female fetus is implanted in the mother's uterus, actually genitourinary tract will have some anomalies. Maldevelopment. So maldeveloped genitourinary tract of a female, after the female borns, during the growth of the female child, actually the uterus may get affected. Sometimes the tubes may not be there, tubes absent, sometimes uterus absent, sometimes uterus will be divided, sometimes uterus will be in the love shape, love symbol shape, arcuate uterus, uterine didelphys, unicornuate uterus, bicornuate uterus. This kind of anomalies will occur. Sometimes tubes may be absent, sometimes ovaries may be absent, sometimes urinary tract also get affected. Sometimes there may be a single kidney, sometimes one kidney absent, only one kidney present, and plus genitourinary tract. This reproductive system also gets affected. These kind of problems may be there. But many of the times, most of the times, there are chromosomal abnormalities in the female. Whenever the fetus is forming for these people, the fetus will have so many single gene defects or deletions, chromosomal abnormalities, deletions, additions, translations. These are all chromosomal abnormalities. Sometimes single gene defects, sometimes many genes will be defective, and most of the times there will be problem in the endometrial cavity. This is the endometrial cavity. This is the uterus. Your uterus will not be this much. This will be very small. But just to explain you, I am just keeping this photo. This is the outer layer of the uterus. This is the middle layer of the uterus. Myometrium we call. Outer layer of the uterus, perimetrium. And the inner layer of the uterus is called endometrium. This endometrium is the exactly right bed to have a baby for implantation. It is the place where the baby gets implanted, where the fetus gets implanted, after that the growth and again delivery. So, sometimes this may be defective, this part may be defective, sometimes this part might got affected, maybe due to some infection, maybe due to some tuberculosis, or all adhesions might have formed because of due to previous infection. Or maybe one septum may be formed, in between there is a wall, and where the fetus go and gets implanted, usually in this place. Actually, if there is a septum, this endometrial cavity is very small, only 3 ml fluid will be filled in the endometrial cavity. If suppose we introduce some fluid, only 3 ml fluid it captures. So, endometrial cavity problem, infection problem, all these problems will be there. Sometimes this uterus will be this much small. Usually nulliparous uterus will be very small, but sometimes enormously it grows this much big, and it cannot able to hold the baby inside, because this is the bed for the baby implantation, and this myometrium and this perimetrium actually it supports. It gives good protection to the baby which is growing inside the endometrium. So what will happen? Suppose if the myometrium gets affected, if the myometrium is not good, the myometrial echogenicity, that is the myometrial structure gets affected, means then it cannot hold the baby properly. The uterus cannot hold the baby properly. So that times it will get aborted. Afterwards, sometimes the condition is we call adenomyosis. So the uterus is enlarged, bulky they will tell. Your doctor will tell it is enlarged so much. So that time usually many people will get aborted. They won't even get their baby up to 2 or 3 months. Usually in the 2nd month or 3rd month early dates they will get aborted. Sometimes 5th month also. Up to 5th month we will give proper bed rest, and suppose somehow we will give the baby to that certain level, that 5th month or 6th month, it would definitely it gets aborted. So the best option for this is surrogacy treatment. And chromosomal anomalies we have to find out and we have to get it treated. To treat the chromosomal anomalies, we are having PGS, pre-genetic screening method. In that method we can definitely conclude this baby, this fetus is not good, this fetus is not good, this embryo is not good. At the embryonic level only we will conclude that the embryo is good or not. Only good embryos we can implant and the bad embryos we have to take out. So PGS will help us to treat the chromosomal anomalies. Sometimes torch infections also, actually it cannot, if the mother is having toxoplasma or rubella, cytomegalovirus, herpes simplex virus, these are torch panel. These infections affects the baby. From the mother it goes through placenta and it affects the baby, and again the babies get aborted. So we have to treat torch infections also. And afterwards sometimes antithyroid antibodies, in the immunological factors, blood defects, clotting factor defects, sometimes antiphospholipid antibodies, antithyroid antibodies, anticardiolipin antibodies, or anti-lupus antibodies. These kind of antibodies also at immunological level or blood factors, they also will cause abortions in many patients. So all these things actually we have to go in a proper way. We have to estimate what is the problem exactly, why the abortions are happening. So we have to treat each cause, whatever is the cause for abortion, we have to treat and we have to make them parents. And sometimes there may be fibroids also, sometimes many fibroids, cornual fibroid or the fibroid in the fundus, the fibroid in the cervix, they also cause pregnancy loss. So we have to treat the particular cause. Sometimes the septate uterine septum, the septum should be removed. After that also few people will conceive and have normal pregnancy, but many people will not conceive, will not have normal pregnancy. So the other options in the treatment will be available.